Uganda is where HIV/AIDS was first discovered. Everyone in the country has been affected by this unprecedented public health crisis. While effective prevention has made Uganda one of the few countries in Africa where prevalence has decreased, in the past, little could be done for those who were already infected.
We are not the people like the other years, that today, now they have tested, I'm going to die, I'm alone. No, we are many, we are not alone.
Although sadly, still not available to everyone, there is new hope for many who are suffering from AIDS in Uganda. After years of waiting, antiretroviral medications, or ARVs, have finally become more available, thanks to several well-funded international initiatives. In tribal tradition, there were hundreds of specific drum messages that inform the people of important news. When anyone heard the drums, it was their responsibility to repeat the message so that the largest number of people would be alerted. With the scaling up of antiretroviral therapies and new community-based support systems bringing hope, there are many reasons to beat the drum loudly.
I'm called Canon Gideon Biamugisha. I am an HIV-positive religious leader. I work with World Vision International as the HIV/AIDS advisor in the HIV/AIDS Hope Initiative. I am the chairman of the Africa Network of religious leaders living with and personally affected by HIV/AIDS. I'm also a commissioner on the Uganda AIDS Commission. There are good news about HIV/AIDS. The first piece of good news is that HIV is now preventable. We know how it is transmitted. We know how it is prevented. So people living with HIV/AIDS like me can join in efforts to break the transmission chain. And that is very, very important if we are to reduce the prevalence and to cut down the numbers of new infections or transmitting our virus from ourselves to our children or to our spouses. That's very, very important, that HIV is preventable. It's not inevitable that we must continue having new infections. The second piece of good news is that HIV/AIDS is now manageable. You can live long and productively for yourself, for your country, for your family with the virus. You can manage it. There is treatment available to prolong your life, to forestall opportunistic infections. Most of the opportunistic infections are actually treatable, like TB and others.
Several low-cost community-based delivery and adherence systems have emerged to address the general lack of resources and a vast need for services. One is the Reach Out program, established by the Mbuya Catholic Church on the outskirts of Kampala. Father Joseph Archetti is the parish priest.
I am proud, not because it's due to me. I am proud because I can witness to some realities which maybe people, even people in high positions, don't believe. For example, the strength of the community. That the community can fight against every evil. And if the community is enlightened, the community is helped to understand the truth about certain situation, the community will be able to overcome that situation.
Reach Out is showing how a community can come together to deal with even the most serious of public health emergencies.
Most people think that if you want to help people who are sick, you have to have buildings, cars, offices. That's what they first think of. But they can learn from Reach Out that from just within a small part, from just the church, we have opened up to help almost 1,600 clients.
Reach Out started as a volunteer program to address the community's needs. 3 times a week, the church is converted into a clinic, providing comprehensive care to those in the parish affected by HIV/AIDS. Dr. Margrethe Juncker has been instrumental in bringing medical support to Reach Out, but she believes that she and other volunteers are receiving at least as much as the clients.
I think that there's a lot of our volunteers here who, like myself, feel it as a gift that you can live your religion perhaps instead of preaching in it. And I think that's an important part, that you're given a chance to do something. And actually, I am very happy for the chance that I have to work here. And when people want to come and be part of Reach Out, I take it that we are actually giving them a wonderful chance.
And so it seems. For many, Reach Out, although dealing with the worst public health crisis in human history, is a wonderful place to work.
My name, I'm called Rosemary Mugalula. You can add on Namuli. I'm a widow. My husband passed away in 2001, in November. Before I joined Reach Out, I was working as a librarian in one of the school which is under the parish, which is St. Chisto Secondary School. I was there for a couple of 4 years. So by that time, I started falling sick, on and off, on and off, on and off. I didn't know what was happening. In December 2001, the parish priest, Father Joseph, called me and told me that there is a certain doctor who has started coming here. She will be helping people who are sick and helping people who are in the community. So can you come one day and you meet her so that you can discuss with her your problems? It was 3rd December 2001. I came. That was the day I met Dr. Margrethe.
Yes. Yes.
Here in Reach Out, what helps very much to take away the stigmatization and so on is the fact that our volunteers were clients and volunteers together. So much so that if you come here now and you look at people, you don't even realize who is sick and who is not sick.
Next, move the right leg forward.
Especially innovative is that the recipients of assistance are becoming caregivers.
I'm Rosemary. By the time I joined Reach Out, the first thing Dr. Margrethe told me that, Rose, as I have seen you the first time, I feel you should be the first person where all the people, they should reach first and they can go everywhere. You have to be the head of the reception. Since the time I joined Reach Out, I'm the head of the reception.
Oh, you have already one.
I went and tested my CD4. I had 37 CD4 count. I had nothing to do. They told me to enroll me in their program. They put me in their program and I started the ARV. That was in June 2003. After 3 months, my CD4 counts raised up because by the time of 3 months, I had 158 from 37. So I gained, my kilograms increased because by the time I started ARV, I was only 46. I came to 52, 53, 54, now I'm in 65. I feel I'm happy. I'm very happy.
In Mbuya, when they talk about positive living, they are not only referring to those who carry the virus.